everyone. Welcome to our education for this week. This education that we're going to do today is not in your education booklet, but I am going to pull a PowerPoint presentation on the screen so you can follow along. I decided to go back to kind of the basics of why you should exercise with a cancer diagnosis and what's the importance of exercise when you're diagnosed with cancer and beyond being a cancer survivor. So this is a PowerPoint presentation on that. Remember, it's not in your education booklet, but I am going to pull it up on the screen. So let's go ahead and share the screen. All right, so the title of this is called Get Moving, Cancer and Exercise. So why is exercise so important as a cancer survivor? So we're going to talk about that. And remember, as always, if you have any questions, then you can always email me, or when I call, you can just ask me any questions that you have about this presentation moving forward. So Get Moving, Cancer and Exercise. So let's just talk about cancer survivors. So once you're diagnosed with cancer, you're considered a cancer survivor. So there are over 15 million cancer survivors in the US today, and it's expected to increase to over 20 million by 2026. So just in 5 years, there should be over 20 million cancer survivors. So why is that? We can look at it as a bad thing, that's how many people are diagnosed with cancer, or look at it as these people are diagnosed with cancer, you're diagnosed, but you're living longer, you're living lives, you're diagnosed with cancer, and you go into remission and you continue on with your life. So why is that? There's early detection. So a lot of the testing is done earlier. We have certain risk factors that get you in for testing. Think about mammograms, think about colonoscopies, think about all the testing that goes into now early detection of a lot of the most common cancers. There's improved diagnostic methods. So mammograms, testing for the cancers, to catch the cancers earlier have improved over the years. The treatments are better. So now we have more targeted treatments than we had, 20, 30 years ago. There's more immunotherapy, things that target that specific type of cancer. Is just going to lead to a better prognosis. Your clinical follow-up treatment is better. So the treatment after you have surgery, the treatment after you have radiation, after you have chemotherapy is better. So people are living longer. And then just the post-cancer healthcare programs. So now you see a lot more programs targeting cancer survivors, people who are in remission, people who are finished with treatment. You have more programs targeting that. So that's why, you have more cancer survivors. So now that, maybe you're diagnosed, maybe you're still in treatment, maybe you're not, maybe you have prolonged treatment. So what are some of the challenges now? So of course, there's always going to be the fear, the chance of recurrent cancer. So you're always thinking about, what if my cancer comes back? Am I doing the right things to prevent my cancer from coming back? And I always say for the next one, other chronic diseases. I rarely see somebody who's diagnosed with just cancer. Now, you do see that. That's their only thing in their health history, but it's rare. So normally, if you're a cancer survivor, you're dealing with diabetes, you're dealing with hypertension, high cholesterol, obesity, osteoporosis. So you have all these other comorbidities that you're trying to manage, as well as being a cancer survivor and dealing with the effects of cancer and treatment. So also persistent adverse effects on physical functioning. So now that you've gone through treatment, you've gone through surgery, you've gone through everything, you may have lasting effects from that treatment. So you may still have neuropathy. Remember, we talked about the tingling in your hands and your feet, fatigue, weakness, joint pain. So all those things you may be dealing with now that you weren't before. And then just your quality of life. It may be different now, and chances are it is different now. You're not the same socially. Emotionally, you're different. Physical, functionally. So you're just, there's a term that a lot of times I hear a lot is the new normal. So now you're not going to be the way you were before. You're trying to deal with a different quality of life and how to cope with that. So those are some things that are challenging now. So now that you have the things that are challenging, so what does being a cancer survivor, what does that do to you physically? So we kind of mentioned it a little bit in the previous slide, but what does that do to you physically? So, now you may be experiencing, most cancer survivors experience that fatigue. So that debilitating fatigue. You may have loss of coordination, reduced heart, lung, and circulatory function from your treatment, muscle weakness and atrophy. So that atrophy means your muscles are wasting, and that's just because you're not using them. You're maybe not as active as you were before, and your muscles are weak And then maybe just side effects from the treatment, your muscles are weak. Weight changes either up or down. So cancer survivors sometimes see their weight go up, sometimes they see it go down. So that could be either way. Difficulty sleeping, and then of course, some of the classic symptoms of chemotherapy, the nausea, the vomiting, the pain, and all those things. So those are what cancer has done to you physically, and they may be lasting effects. But a lot of the times we don't talk about the mental state of cancer. What does cancer do to you mentally? And sometimes that's just as, it's not as just, it is just as important as the physical. So psychologically, you have that fatigue. We talk about that brain fog. You're just tired. You can't remember the things. You have depression. You have anxiety, stress. All those things that come with, getting diagnosed with cancer. All those things come with it. Body image concerns. You don't feel the same about your body. Maybe you've had a mastectomy. Maybe you've had other things. And you just don't feel the same. So you're concerned about your body. So, and that can lead to decreased self-esteem. You just don't feel the way you used to, about how you look, or about yourself. And then you have a loss of a sense of control. You used to have a plan. Everything used to be together. Now it just seems like everything is in disarray. So those are things that you're dealing with mentally, as long with the physical. So it's a lot. So this is that slide. If you've seen our talk on fatigue before, just that fatigue. So that was two things that was common in both the physical and the mental, and that was fatigue. So remember, fatigue can be mental and it can be physical. So that's, that overall feeling of tiredness, weakness, lack of energy. So, it's not just a normal tired. It's not that. It's that I am debilitated from this tiredness. I can't do anything. And it's from the cancer itself and from treatment. And so we normally use, in cancer fit, a scale of 10 to 1. 10 is no fatigue and 1 is the worst. So remember, you always want to aim for moderate, and you want to rest when you feel like you're the worst. So what about fatigue and quality of life? So remember, fatigue is both physical and psychological, and fatigue occurs in most cancer survivors. And then, of course, it significantly affects your quality of life, your daily routine. If you're tired, you're not going to want to do anything. So that's one thing that we really try to use exercise for. So how can you combat fatigue? So, the traditional approach, psychologically, you can use, cognitive behavioral therapies, education on how to deal with it, support groups. And then physically, we said, okay, before they said just rest, if you're tired, rest. And there's still some truth to that. But what we want to focus on is exercise. Exercise is proven to benefit so many other diseases. So if you had a heart attack, your doctor would recommend that you go to cardiac rehab. If you had pulmonary issues, breathing issues, they probably would say, oh, well, you need to go to a pulmonary rehabilitation program and, help with your breathing. If you had diabetes, obesity, any other medical issue, a doctor would say you need to exercise. So cancer is the exact same way. If you have diagnosed with cancer and experiencing fatigue, you need to exercise. And there's research from the American Cancer Society and the American College of Sports Medicine saying that cancer survivors should exercise from regular, moderate exercise. So now we just want to avoid inactivity. That's the main thing. Do something. And then the main thing that I say when you do something is to pace yourself. So a lot of times, you see the little roller coaster here. We talk about fatigue. And it's a roller coaster ride, right? You have days where you feel up, 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 and down, 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 up, 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 down, down, down. So what happens with a lot of people, and just in general, when we feel bad for several days, we feel like our life is passing us by, we're not getting stuff done. And so we have a day where we feel good, we try to overwork and we do too much, and then we go back to sinking down. So we don't want it to be up and down. You feel bad for 3 days and you feel good for 1 and you do everything, and then you feel bad because you did everything. So it's just, we don't want to do that. So we want to break that cycle from prioritizing your activities and pacing yourself. Don't do too much too soon. Do a little bit at a time. If you have 5 things to get done one day, maybe just do 2, so pace yourself. Same thing with exercise. We want you to get 30 minutes, maybe just start with 10. So physical activity can help you overcome some fatigue. It's going to increase your baseline strength, your baseline endurance. So it's going to become easier. Your heart's not going to work as hard, and it'll make you less fatigued. So we just want to make sure that we pace ourselves. So the next slide, this is just some of the well-proven facts of benefits of exercise. So these are across the board for everybody. It improves your exercise capacity, so your ability to walk further, do more without getting out of breath, without feeling that your heart is racing. Your heart becomes stronger. It increases your muscle strength, so you're stronger, you're able to do more, you're able to lift more. Your body composition changes. Hopefully, from exercising, you're going to increase your muscle mass and reduce your fat mass. Your fatigue is better and your immune function is better from exercising. And those things are proven benefits. Psychologically, you just feel better. You feel like you have a better quality of life. And that may be because you're able to do more. So you feel better, that you're coping better in life. You have less stress, less fatigue. You feel better about yourself. Maybe, you're exercising, so your body feels better, and you just automatically think that you look better. And then your mood stays. You have less anxiety, less depression. You're just in a better mood. So remember, exercise releases hormones, endorphins that actually make you feel better. So exercise is medicine. It like I talked about before, like obesity and heart disease, pulmonary disease, exercise has been shown and proven to help with those things. So it is a form of medicine. It can help you feel better. So it increases, you can manage your comorbidities better. So remember, it helps lower your blood pressure. It helps lower your cholesterol. It helps, decrease your body fat percentage. It helps lower your blood sugar. So you have, all those things, it can help manage those risk factors. So it is a form of medicine. So exercising with cancer. And so this is just kind of general what I've gone over before. So frequency, intensity, and time. So American College of Sports Medicine and American Cancer Society says that you should get 150 minutes of moderate intensity exercise a week. Now, this is not a beginning goal. This is an end goal. So if you say 150 minutes, that's roughly 30 minutes, 5 days a week. But that's an end goal, So remember, we're pacing ourselves. So you need to just do 10 minutes, but 150 minutes is the end goal. So remember, aerobic exercise is everything that gets your heart rate up. So that's walking, ellipticals, rowers, a bike, group exercise classes. Make sure that you're careful of, the type of cancer that you've had, treatment or surgery. So of course, you want to make sure that you're doing something that's safe for you. The way we measure intensity, so we talked about moderate. So I didn't talk about vigorous, just that moderate intensity. You don't want to overwork. So if you go down to that 4 to 6 where it says moderate activity, it feels like you can exercise, you're breathing a little bit heavy, and you can hold a short conversation. So it's not like it's really easy, but it's moderate. It's not hard where you feel like you're going to pass out, and then it's not so easy like you feel like you can do it all day. It's right in that moderate activity. We also can take heart rate range by taking 220 minus your age, and then 50 to 75% of that. That's roughly where your heart rate should be at when you're exercising. But I like the RPE chart better because that's how you feel, and I rather how you feel more than anything. So always moderate activity. Strength training, you want to do strength training. That's your bands, your weights, 2 to 3 sessions weekly. But again, this is the end goal. Try to get up to 8 to 10 exercises and 10 to 15 reps. So if you have your education booklet, you have some strength training exercises in there, as well as the videos that you'll see. So those are appropriate. When you get up to the point, you want to do that at least 2 times a week. So of course, you need muscle strength for everything you do. So if it's cleaning, it's cooking, it's shopping, it's living your everyday life, it's getting up out of a chair, you need your muscle strength. So that's why it's really important to do some type of strength training to maintain our independence. Again, you want to be careful of surgical areas, weak areas due to chemo, radiation, skincare, ports. So if you have any questions, you do want to ask an exercise physiologist or see a professional before you start a strength training program. And then flexibility is also important. I talk about stretching and why that's important. And your education booklet, you have some stretches. You'll also have videos that I've sent with stretches. So you want to make sure that you stretch every day, really. Every day that you exercise, you want to make sure you stretch. You do want to stretch at the very end when your muscles are warm. So especially if you're exercising, try to stretch at the end of your exercise, because it's going to help loosen up those muscles and help them from getting so tight. Chair yoga is an awesome option. Of course, I send out chair yoga videos as well. And then relaxation, that's another topic that you'll find in your education booklet, but that helps too. It helps de-stress, it helps with anxiety and depression. So it's an important component to exercise as well, to get that relaxation piece in there. So let's say you have a goal. How do you set goals? So goals should be SMART, and of course that's an acronym. So it should be specific, so clear and precise. So let's say I have a goal and this one says I wanna, start exercising. So I'm gonna be very specific, clear, and precise. I'm gonna walk on the treadmill for 30 minutes, 3 days a week. Or maybe I'm gonna walk outside 2 days a week. Or maybe I'm gonna walk to my mailbox and back 2 days a week. So it doesn't have to be this great grand goal. It could be very small. So remember, we talked about pacing ourselves. So just whatever you have a goal, make it specific and clear. That's the more you're going to adhere to it. Measurable. So you want to track your progress. So if you don't have anything you can measure, you don't know if you're meeting your goals or not. So let's say I want to lose 1 pound for 4 weeks. I can measure that. I can step on a scale and make sure I'm losing 1 pound a week for 4 weeks. It has to be action oriented. You have to be able to do something. So you can't make a passive goal by saying, I'm going to lose, 4 pounds. Well, how are you going to lose that 4 pounds? I'm going to walk 3 times a week. So you have to make it action oriented. Realistic, that is a very important one. Sometimes we make goals and they're just not really realistic. I want to lose 50 pounds this month. That's probably not really realistic. So how about I just start with, I want to walk 3 days a week. That is realistic. That is something that we can do. We can walk 3 days a week. So it has to be realistic so you can reach your goals. Do not set yourself up for failure. And a lot of times, our goals aren't realistic. We set ourselves up for failure, making goals that we know we can't reach. I always give the example, I'm a morning person. So if I wanted to start an exercise program, I would never say I'm going to exercise in the evening. I would never make it because I'm a morning person. That's not realistic for me. I need to exercise in the morning. So you have to tailor your goals to you and make them realistic for you. And then time, give yourself time. This one says I'll be able to complete 30 minutes on the elliptical in 2 months. So give yourself an end date, because if you don't have an end date and it's just ever going, then it's not gonna probably come to fruition. So these are just how to set goals and reach them. Again, you may not be at this point where you're goal setting. You may be at a point where you're like, look, I just need to move, and that's fine. This is just, a way to help us set goals. And this line is no one size fits all. So your exercise plan should be individualized to meet your needs and your fitness levels. So you have to think about who you are as a person and what you need. I wish there was a one size fits all approach where I could just do this one thing and it works for everybody, but it's not. Everybody is very individual. So you got to think about your body is different. Your friend, they told you they did this and it worked great for them, and it may not work great for you because you're different. So again, talk to a professional about what's a good exercise plan for you. And then the last slide is just, again, this is in your education booklet, just lymphedema and exercise. What I'm going to say about this, if you do have lymphedema or you have had lymph nodes removed or a mastectomy, just be careful of that site. Make sure you're paying attention to it. Make sure you don't have any swelling. If you do notice any swelling, redness, burning, anything like that, call your doctor right away, just to make sure it's not lymphedema. You can exercise safely with lymphedema. You want to just make sure that you start slow and go slow. So the American Cancer Society, American College of Sports Medicine did say it was the research has shown that exercise does not make lymphedema worse, but most important, you do want to pay attention to your body. So summary from all that is, try to be active at least every other day if you can. But again, manage your fatigue, build up to 30 minutes. So you want to remember that 150 minutes a week is an end goal, not a start goal. Start slow and progress slow. Pace yourself. Always moderate intensity. Remember, I talked about, you never want to work so hard where you're going to pass out. Always that moderate intensity. Try to find something that you do enjoy. I know not a lot of people enjoy exercise, but if you try to find something you just like a little bit, that's the better that you'll stick to it. You want to always try to include aerobic resistance and stretching. And then even the modest amounts, the smallest amounts is going to help. So again, if you're just going to walk to your mailbox and back 3 times a week, then that's it. So don't think that is too small. It's not going to help. So again, I just want to share just general guidelines for exercise, why you should exercise as a cancer survivor. That was kind of a summary of everything in your education booklet, kind of in 20 minutes or less. So again, if you have any questions, let me know. I hope you enjoyed this, and I hope you have a great rest of your day. Thank you.